And more cases of a deadly virus from China are popping up all around the world. France became the first country in Europe with the coronavirus. 3 confirmed cases there, according to their health minister. New cases have also appeared in Vietnam, Japan, and Singapore. China has taken extreme measures to try to stop the spread of the virus, sealing off transportation for 30 million of its residents after 41 people died. More than 1,200 now are ill from that virus. There are also now 2 confirmed cases here in the United States. The first, a man in Washington state earlier this week. The second, closer to home. Today, health leaders in Chicago announced a woman there has the virus. So how concerned should we be here in Ohio? NBC4's Eric Halperin has been talking with the director of the state health department, and I think around the world health leaders are worried about this virus.
Colleen, they are, but the CDC says the risk to the American public right now is low, and that, of course, applies to Ohio as well. Doctors here want you to keep doing what you usually do when it comes to hygiene. Wash your hands and cover your mouth.
The new strain of the coronavirus, known as the novel coronavirus, is now considered a Class A immediately reportable disease in Ohio.
We are doing an epidemiologic investigation. We're basically doing the detective work.
It means any confirmed or suspected cases must be reported to local health officials right away. Ohio Department of Health Director, Dr. Amy Acton.
If you're a person who has traveled in the Wuhan region or been at all exposed to someone who has this virus, then we would want to know.
To be clear, no cases have been reported in Ohio. The 2 confirmed cases in the United States are in Washington state and Chicago. Both patients had been to Wuhan, China, where the virus is centered, and both are in stable condition.
I'm always concerned when there is the emergence of a new virus. But right now, the immediate risk to the American public is low.
Some symptoms of coronavirus are difficulty breathing, coughing, or a fever. Symptoms similar to common viruses this time of year. Dr. Acton says if you have those symptoms, unless you've been in Wuhan recently or around someone that has the new coronavirus, it's more likely you have something else.
Stay tuned. We'll learn more about this, but I feel that people are very safe right now if they're taking the regular precautions of fighting infection by basic hygiene.
And Dr. Acton wants people to know they are watching the coronavirus very closely, but she says there is still a much higher chance of getting the flu, so she is urging people to get the flu shot if you have not already. Local for you, I'm Eric Halperin, NBC4.
Thank you so much, Eric.